Reopening Texas and the country, creating a lot of new questions around COVID-19. Are we really on the back end of this crisis? Joining me now is Dr. David Winter from Baylor Scott & White Health. Good to see you as always. What is the vibe there at the hospital this week? So 1 week after we talked last.
Yeah, Sonia, we're still relatively flat in hospital cases with COVID and in new diagnoses of COVID. Hadn't gone up. We're still worried there may be a surge coming. We're not seeing that now. We still have plenty of hospital beds, plenty of ICU beds, plenty of ventilators. So we're prepared if it happens. But so far, we're flat, thank goodness.
Okay, yeah, that is good news. I like to hear that. And Dr. Winter, you know, we just heard Mayor Johnson say, look, we're not out of the woods yet. And so how should this reopening really shift people's daily habits, or should it?
Well, I think it should, Sonia. The virus is not gone. It's not going away. It'll be here for a long time. So the same measures we've been talking about. You've got to keep your hands clean. If you touch something that has COVID virus on it, touch your face, you're going to get the infection, or you're likely to. If somebody is coughing or sneezing, or if they're actually breathing hard around you, you could get it if they have it. So masks are important. 6 feet of physical distancing, I think, is very important. The same rules persist. I'm concerned we're going to have a surge in certain areas where people don't do these things very well, and it'll stay flat or start to go down in other areas where we do it right. So it's all dependent on you yourself, what you do to protect yourself and your family.
Okay, so what does that exactly look like to you? Does that mean wear masks out? Does that mean, what, I'm thinking about all the women, frankly, who are going to be rushing to hair and nail salons, especially today and over the weekend.
Yes, you should wear, in my view, you should wear your mask wherever you go. Now, when I go out for a jog, I may not wear it, but I'm going to have it with me. If I get close to somebody, then I may put it on. If I'm hopefully get my hair cut this weekend also, I'm going to go in there with a mask. Now, if they'd have to take it off to get around my ears, okay, fine, then I can put it back on again. I'm going to wear it as much as I can. I think everyone should. Also to remember, when you put that mask on, if the virus is going to get on the mask, it's in the middle of it, so don't touch that part of the mask. Just touch the earpieces or the ties behind the back of the head. A good thing that a lot of people aren't aware of right now.
And then when it comes to employers, business owners, whether we're talking about a restaurant or one of these salons, should their employees also be wearing masks or gloves or staying, farther apart or as much as possible as their customers and patrons?
Yeah, I'm advising the employers, when their employees come back to work, screen them, ask them the questions for the symptoms of the virus. If they say yes to any of those, send them back home. Measure their temperature. If it's positive, send them home. And then also have them wear a mask, be at least 6 feet apart where possible, and continually wash or disinfect your hands. All those rules should apply when you go back to work.
What about, I'm getting a lot of questions from pregnant women, from people who have, children, from people who are immunocompromised. What is your advice for them as far as going out into some of these public spaces now?
There's no question that people who have other illnesses, heart problems, lung problems, kidney problems, if they're on any kind of immunomodulating drug, pregnant women perhaps also, those folks are high susceptibility for catching this virus. So they also tend to do the worst. Now, not pregnant women, they seem to be doing fine themselves, but the older folks over age 60 or 65, folks with other illnesses, they do worse, they're more likely to get it, and they're more likely to have a worse outcome, or at least a longer outcome with this. The younger folks, though, they're not spared with this. We keep learning more about this virus all the time. A couple of weeks ago, we learned blood clots are more common in younger folks for some reason. This new thing came out this week, this rash on babies from the virus. So I don't know if this virus is changing. We've asked our scientists, and they're not sure about this either. But we're finding more things about this virus. We still don't know the whole story, so much more to learn.
So let me just be clear. Are you telling those people to sort of still stay put or stay home or not expand your circle so quickly?
I would think folks that have increased risk of the virus, yes, should continue to hunker down, we say, if at all possible. Now, we're still getting out in the neighborhood. You can sit out in the neighborhood with chairs 6 feet apart. I still keep the mask on if I'm worried about the people that I'm with. We can start to socialize some, but we've got to be careful. This virus is still extremely contagious and extremely dangerous for many people.
Okay, Dr. David Winter, thank you for your time. As always, we'll check back in with you next week. We appreciate it.